Bowel cancer in young people under 50 is on the rise globally, with some of the steepest increases being seen in England. I'm joined by Gemma today to share her experiences of having had bowel cancer and effective treatment.
So things started for me just after Christmas in the January 23, and I'd just got one symptom, which was a little bit of bleeding on the tissue. So I had a phone call appointment with the GP, and I had questions like, was I extremely tired? Have I lost weight? Is there a lot of blood in the pan? Have my stools changed colour? Are they thin in sort of how they look? And I didn't have any of those, to which I was then told not to worry about it. You're doing a lot of fitness and weight work. It's probably one of those things, hemorrhoids for instance, that will just disappear with time. I left it for a couple of months and this symptom just kept cropping up. I thought, well, nobody has actually checked whether I've got a hemorrhoid. So I made another appointment and insisted that I have a face-to-face with the GP rather than a phone call. And that's when I went and they did all of my obs. And the first thing was that they said, you need to do a fit test. Which was really, really simple. She said, just go to the toilet as normal. You have a little tiny pot with a spatula and it's literally the tiniest little thing that you take and put in a pot. So I literally put it in the pot, sealed the envelope, walked to the post box, popped it in the post. Within a couple of days, I then had a phone call from the GP to say that they'd had my fit test result and it had come back positive.
So when you had that news that it had come back positive, what happened next?
At that point, she said it's nothing to feel alarmed about, but it perhaps needs investigating a little bit further. And within a couple of days, I actually had my colonoscopy done on a weekend. And I was really fortunate that they were able to do it so quickly and I had a consultant. And it was there and then that the consultant did say to me, well done for going to your GP and well done to the GP for sending you here today. And that niggle, I'm glad I pursued. I was then taken into a room with a consultant and the nurse. And it was that point that alarm bells were really ringing for me. They had found something, but they weren't sure what it was. And they'd taken some biopsies during the colonoscopy. They were able to do that, didn't feel a thing, didn't even know that that's what they were doing. And he then informed me that I was going to be put on a screening pathway. And with that pathway, things were going to move very, very quickly. And I would have a CT scan and an MRI scan, and that would determine what it is that they were looking at and whether I would need any treatment, what course of action that they would then have to take. And I think that was probably, out of all of it, the worst bit, was the fear of the unknown, knowing there was something, but not actually knowing what it was.
And then when you did find out that it was bowel cancer, what were some of the thoughts and feelings that were going through your mind then?
So we went for the meeting with the consultant who informed me that I'd got a stage 2 cancer. And although that news was devastating and really hard to hear, what she then informed me of was, but you've been lucky that it's been caught early. And with that, we're looking to give you a cure. Within a couple of weeks, I was with an oncologist who was telling me what my treatment was going to be, how I was going to feel, what the side effects were going to be. And 3 weeks, I think it was, after I saw the oncologist, my treatment started. So from point of diagnosis in June, I'd gone through all of my treatment, which did work. It was a successful treatment, but for belt and braces, I then had an operation in the February. And by the end of February, I'd gone through that cancer journey and come out the other side.
What's life like for you now?
The positive from it, I would say, is that I know that for the next 5 years, having had the cancer, that I am going to be checked. And if there were to be anything else roaming around in my body, it's going to be picked up really early. I'm in the system now. I think I've probably seen the very best that the NHS has to offer. And it's been a first-class experience for me.
What sort of things are you able to enjoy now?
Day-to-day life is back to normal. I'm involved with my children's lives, with all of their sport. I'm back doing my own sporting activities. I'm back at work, back out socialising as I was before. Life is normal, but a new normal. I think the best advice that I can give is you know your body best. and you know if something isn't quite right. And even if you don't fit the atypical symptoms of bowel cancer, and you can research it and look it up and you can read the leaflets, if you still feel that there is something not quite right with yourself, you need to go and get checked out, because more often than not, you will know whether there's something that needs to be done.
Please look out for changes, signs and symptoms, whatever your age. Let's work together to catch bowel cancer at the earliest stage so we can get the best treatment outcomes, like Gemma.